Welcome to Maritime Medicine. This is Jonathan Busco, and in this session, we'll discuss bloodborne pathogens, the transmission of these diseases, and prevention of their transmission. By the end of this session, you'll be able to quantify the risks to workers of exposure to bloodborne pathogens, identify and describe at least 3 recognized bloodborne pathogens, and list actions from OSHA's Bloodborne Pathogen Standard to prevent transmission of bloodborne pathogens for you as essentially a healthcare provider. The first rule of medical ethics is primum non nocere, first do no harm. In this case, do no harm to yourself or your crew, so always safety first. In the U.S., there are almost 6 million workers at risk for bloodborne pathogen exposure, and each year about 1 in 6 healthcare workers gets exposed. So 80% of those are needle sticks. The obvious solution here is don't use needles. Unfortunately, they're a critical part of what we do, and so we need to learn how to be safe using needles. Now, the rules that guide your practice may not necessarily be from the Occupational Safety and Health Administration, but in the U.S., they disseminate a standard regarding this, and it requires worker and workplace protection to reduce or remove bloodborne pathogen hazards whenever possible through changes in technique or changes in technology. And while the rule applies to employers, written in that rule is an expectation that the employees will follow the employer's SOPs, and if they fail to, they may not receive protections. As mentioned, 80% of bloodborne pathogen exposures in the U.S. and healthcare occur from needle sticks. The other 20% come from 2 sources, either cuts from other contaminated sharp items or contact with mucous membranes or broken skin. And that's contact with a potentially infectious material. Now, our body does protect us from bloodborne pathogens. Our immune system is the key part of that. And we have physical barriers like our skin. Intact skin is an amazing barrier. It's almost impenetrable by most viruses and bacteria. The problem is, as any of you who've ever wiped Purell or alcohol-based cleaner on your hands know, our skin is not particularly intact, and all those little breaks are portals of entry for infectious diseases. We have chemical barriers like the acid in our stomach, which kills most invaders. And we have immune barriers like the mucous membranes, which are designed to capture and remove foreign invaders, and then specific immunity against some diseases. So given that, how do infections occur? Well, you have to have some infectious agent, some thing that actually causes an infection, and it lives in a reservoir somewhere, a host, and it may or may not be harming the host, and it has some means of exiting and a mode of transmission, a way that it can get out of the host body and be transmitted to a new individual for an infection. And so then you have to have a way of getting into that new host, and that host has to be susceptible. So let's just say the infectious agent is HIV. One person, one host has it, and the means of exit is through a wound and bleeding. The mode of transmission is that blood. It enters into the susceptible host by an open cut on the skin, and since that susceptible host is unlikely to have immunity to HIV, they become infected. So there's various modes of transmission. The one we just talked about is direct contact, so either from one host to another or touching infected fluids. Indirect contact comes through things called fomites, and those are items that can carry disease. The stethoscope is a perfect example of that. Stethoscopes are rarely cleaned and will often carry infectious agents. Airborne or droplet transmission, as happens with meningitis or TB, can also cause infection, be a mode of transmission. And vector-borne transmission, like animal bites, as in the case of rabies, or insect bites, as in the case of West Nile virus or Lyme disease, are other modes of transmission. The most common infectious agents are viruses, by far the greatest number of infectious agents. After that, bacteria, and then in much, much lower numbers, fungus, the fungi, protozoans, and parasites. So why are viruses so effective? Well, they're everywhere. They're very primitive. There's some debate as to whether or not they're even alive, or if they're simply protein-based mechanical traps. They're very simple, and their systems are highly effective. They basically invade your cells and take them over. So in the case of viral hepatitis, they invade liver cells. They make those cells reproduce the viruses and then cause those cells to burst, or other things can happen as well. HIV, influenza, and the common cold, the rhinoviruses, the arboviruses, are all highly effective viral infectious agents. Bacteria are more complex. They're actually alive. They're single-cell organisms, and they cause localized disease until they spread. So, for example, the pneumococcus bacteria can cause a local pneumonia, an infection in the lung, and then spread to the brain and cause a meningitis. Meningococcus, on the other hand, typically tends to start as a meningitis or primarily cause a meningitis, but does spread throughout the body, cause other problems as well. Staphylococcus aureus, which lives on all of our skin, lives there without a problem until the skin breaks and it invades and it causes a cellulitis, and if that goes untreated and spreads, it can go to your lungs, it can go to the heart, it can be widespread and cause widespread damage, septic shock, and death. Fungi are multicellular organisms, and usually they only affect local areas like athlete's foot or jock itch in a healthy patient, but in an immunocompromised patient they can cause widespread disease. These are things like candidiasis and the tinnias. Protozoa are multicellular organisms, and they can cause malaria and dysentery, the diarrheal disease, bloody diarrhea. Parasites are multicellular organisms that can invade locally and then spread throughout the body. So the definition of blood-borne pathogens are infectious agents that are carried in blood, blood products, and other potentially infectious body fluids that are infectious to humans and result in severe deadly disease. While there are other infectious agents carried in blood products or other infectious fluids that are infectious to humans, if they don't result in severe or deadly disease, they're not of as much concern as these true blood-borne pathogens. These are the potentially infectious body fluids. You note that sputum or spit is not on there unless it's visibly contaminated with blood. So these are all fluids that are more or less difficult to come in contact with, but tend to be highly infectious and tend to carry a large burden of the infectious agents. Now, if you or a crewmate have a blood-borne pathogen exposure, you have to take it seriously, but exposure doesn't equal infection. Just because you're sprayed with blood doesn't mean that you're going to end up with HIV. There has to be HIV in the blood in sufficient quantities to cause the disease, and sufficiently virulent. There are some viruses that some forms of them are very likely to cause disease, and other forms aren't. The entry must occur through an effective route. If you pour blood all over intact skin on your arm and then wash it off, even if it's full of HIV, your risk is very low. On the other hand, if you give yourself a hollow bore needle stick with HIV-infected blood in it, then chances are high that you'll end up with an infection, and you need to be susceptible. And that's general to the species. So if, for example, humans don't contract feline immunodeficiency virus, and then specific to the host immune state. And what that means is that there are people out there who appear to be immune to HIV, but that's very few people. And again, all exposures need to be taken seriously. So what are our major blood-borne pathogens of concern? Well, the big viral ones are HIV, hepatitis B, C, and D, syphilis, and malaria as a protozoan, and then tuberculosis, influenza, and meningococcus causing meningococcal meningitis. HIV is a human immunodeficiency virus. Basically, this virus targets the cells of the immune system and kills them. And so there's an initial flu-like illness, just like any other viral illness, that resolves, and then chronic fatigue and chronic diarrhea. And over time, the patient begins to develop infections that the body normally could handle without a problem. And this is called acquired immunodeficiency syndrome, or AIDS. And the person ultimately dies of infections that the body normally can handle. We now consider HIV to be more of a chronic disease than a necessarily 100% lethal disease due to the medications that are available. People can live full lives and die of other chronic diseases rather than HIV and AIDS. It's a very fragile virus, so within minutes to hours of being outside of the reservoir, you've got blood on a table, it's there for 24 hours, the virus will have died. Now, what are the major issues with HIV? Well, there's no vaccine. There's a limited cure, which is lifelong antiviral medications. And as long as you're on them, it's a chronic illness. You can still potentially spread the disease. And if you go off of them, you'll develop the illness again. There is some recent research on transplantable immunity. That is, there's some individuals who are actually immune to HIV, and it may be possible to transplant that immunity into others, but that's still in the very early phases. Your biggest risks are with hollow bore needle sticks, so starting an IV or giving a shot. 1 in 300 of these exposures to HIV-positive blood seroconvert. That means you get HIV. And to do a risk assessment, go to medcalc.com and search for the HIV needle stick risk assessment stratification protocol. And if you follow that link, you'll actually be able to predict what the risk of HIV infection is. Hepatitis B is also very common. It's a virus. Its primary target is the liver cells, and it's a very robust virus. So unlike HIV, which dies within 24 hours of being outside of its host, this virus can live up to 7 days in dry blood, which means you need to be very careful about policing areas where there was blood, making sure it's properly cleaned up and you're wearing proper personal protective equipment. In the disease, you may be asymptomatic for months, but it is ultimately viral inflammation with all the symptoms that go along with that, the pain, the weight loss, the nausea, vomiting, the skin color changes, the jaundice, and the changes in the colors of the whites of the eyes. It can be severe and even fatal. And some people get the disease and become immune. Others get the disease and have it as a lifelong chronic disease. And again, it presents with a viral syndrome illness. So just like any other viral infection, fatigue, muscle aches and pain, joint aches and pain, some abdominal pain, particularly in the right upper quadrant with nausea and vomiting. When severe liver damage happens, you end up with fluid in the abdomen and swelling in the legs because the liver doesn't make proteins anymore, so the fluid all leaks out of the blood vessels. The skin turns yellow because the liver is responsible for making the proteins that help your blood to clot. You start bleeding. The liver itself gets damaged and scarred. This is called cirrhosis. And you can get primary liver cancer, hepatocellular carcinoma, and hepatitis B is the leading cause of that worldwide. Now, hepatitis B is a preventable infection. There's a highly effective vaccine. You get 3 shots. It's mandated by OSHA for at-risk employees. That is, it has to be offered, although employees can decline it. And it's now considered a childhood immunization. So most people under the age of 20 have received the 3 hepatitis B shots. There's treatment as well. It's only moderately effective. There are a lot of people who end up with chronic disease even despite treatment. So it's best just not to get hepatitis B in the first place. Hepatitis C is also a viral infection of the liver with the hepatitis C virus, and it's the most common chronic bloodborne pathogen in the U.S. People tend to have this as a lifetime infection, and it presents similarly to hepatitis B. It also causes the liver cancer. There's no vaccination. There is treatment with a medication called interferon, and some people think that treatment is worse than the disease itself. And the results are fairly mixed. For some people, they get the interferon and they're cured. No further disease. Others simply slow down the disease progression, but over time it progresses. They end up with the liver failure and can die from this. Now you may see malaria. It's the Plasmodium protozoa, and it's transmitted by mosquito bites. It can also be transmitted as a bloodborne pathogen, so you have to be aware of that in areas where malaria is endemic or present universally. It's a tropical disease. The protozoa reproduces itself inside red blood cells, and then they burst and release more protozoa and toxins into the bloodstream. And this also presents like a flu-like illness. Every patient I've ever seen who's had the diagnosis of malaria, the way I've made the diagnosis is they've said, this feels exactly like I felt the last time I had malaria. Particularly not practicing in a tropical area. These were all people who had traveled to tropical areas, particularly Africa, and who had returned and developed the symptoms. But if you're in an area where malaria is present, or you're taking care of someone who has recently been in an area where malaria has been present, you need to think about this disease. Treatment is with an antiprotozoan medication, and it'll depend on the species. So, because some are resistant, some are not. So you need to figure out where the exposure was and then talk to medical control about what the appropriate anti-malarial medication is. Tuberculosis is a very old and very effective bacteria called Mycobacterium tuberculosis. TB is a pulmonary disease. That is, it's primarily through the lungs, but you end up with multi-systemic symptoms from this. It's the most common cause of infectious disease-related deaths worldwide, more than any other infectious disease. And it's one that's very, very difficult to even think about eradicating. The mycobacterium enters through your lung and it grows in there. And it can be dormant for a very long time. And then it spreads through the body. And the symptoms will depend on where it ends up. You can have primary pulmonary TB with a cough, coughing up blood. You can get meningitis, infection of the linings around the brain. It can go to the bones, particularly the vertebrae. It can go to the gut. It can go to the kidney. And your symptoms will depend on where it ends up. Once it's in your lung, it can be latent there for years. You never know you had the exposure. And then typically in reactivation tuberculosis, patients get a cough with some chest pain and shortness of breath. They may get sweats at night and weight loss. That's very typical. They start to cough up blood and they feel very fatigued. This is consumption. The disease consumption is tuberculosis. And this is sort of the classic picture of the person who slowly wastes away as their body breaks down on itself. Now, if you have any suspicion that a patient may have tuberculosis, they either have the right symptoms or they've been institutionalized or in jail or somewhere where they could have been exposed to TB, then you need to wear an N95 mask or a powered air purifying respirator to protect you from droplet exposure. The treatment is multiple medications, and there's increasing drug resistance because you're on the medications for a very long time, and people tend to not be compliant with the regimens, and so they select for drug-resistant tuberculosis. So now you end up on 3 to 4 medications at a time. Influenza, we all know what the flu is, or we think we do. It's a viral illness with a seasonal occurrence, and it occurs epidemically. That is, it spreads through the whole population. It's a respiratory virus with systemic symptoms. Nausea, vomiting, and diarrhea is not the flu. That's a different type of virus. The flu, influenza virus, goes into your lungs and causes pulmonary symptoms. There's about a 1 in 5,000 chance of dying if you get a flu, and to put that in perspective, you're more likely to die if you get the flu than you are to die in a car accident. Usually this is in the immune vulnerable, but if you think a few years back, the swine flu was actually killing the healthy and not really killing the very young or the very old. Cause of death is either from a pneumonia, it's a viral pneumonia, and then you get a bacterial pneumonia, or they go into shock from widespread infection and the septic response of the body to the infection. There are annual vaccines for flu that are moderately to highly effective depending on how well the flu developers predicted what the prevalent strains would be. If they're very close, very effective. If they miss, less effective. Although, even if there's not a perfect match, your chances of dying from anything, particularly if you're older, go down if you've had the flu vaccine. If you get the flu, the treatment, if you're an otherwise healthy person, is rest fluids and anti-fever medications if you need them to be comfortable. If you're someone at risk, someone with asthma, someone with chronic disease, cancer, liver disease, kidney disease, then we give oral or IV antivirals. But for the healthy individual, those really don't do anything, and they're associated with a fair amount of risk, particularly a risk of seizures, which is a real problem in your line of work. Meningococcal meningitis is caused by Neisseria meningitidis. It's a bacteria. It's a very invasive disease. Often enters through the lungs, spreads rapidly through the body. It's in the bloodstream. It goes to the brain, and it really is an incredibly fast-acting disease. These are people who die within 12 hours of getting sick. It's not the only bacteria that causes meningitis, but it's certainly one of the worst to do it, and it's highly contagious. People with meningococcal meningitis typically will feel poorly for maybe an hour or two, maybe 12 hours, maybe not at all before they feel incredibly badly. They have an acute intense headache, fever, nausea and vomiting, light bothers their eyes, the neck becomes stiff, and it's not just, oh, it hurts when I move my neck. The inflammation of the lining around the spinal cord and brain causes the muscles to go into spasm, and the neck is literally locked up. It cannot move. There can be lethargy or drowsiness. All the patients I've seen who've had this have presented unresponsive, and they may have a rash, small red dots over their body that when you push on them, they don't fade at all. Push down and they don't go away. They don't blanch is the word. So that's petechiae, and that's a very bad sign. This can be prevented with the meningococcal vaccine with a booster, and that's given to teenagers and young adults, and then others at high risk, people in institutions, in the military, where there are a lot of people crowded together where an infection like this could just rip through a large group. The treatment is IV ceftriaxone, IV dexamethasone, or another steroid if you have it available. That prevents hearing loss. These people go deaf with meningococcal meningitis, or have the potential to. And there's another IV medication called vancomycin that if you have it available should also be given. So how do we prevent bloodborne pathogen exposure? We use universal precautions. And universal precautions basically means we treat all blood and body fluids as infectious, no matter what the source. And we use the appropriate personal protective equipment for the degree of risk of exposure. One of the most important things you can do is wash your hands and wash them correctly. How do you do that? You turn on the water and wet your hands. You use soap to lather up your hands, including the backs and wrists, and wash each finger and scrub your hands for 10 to 15 seconds. You want to be able to sing the happy birthday song twice or recite the alphabet. Then rinse your hands under the running water, dry your hands with a paper towel, and turn off the water using the paper towel, and then look and make sure your hands are clean. You can also use waterless hand wash, and if you do that, you don't also wash your hands, you use the alcohol-based wipe. There are a few things that won't kill, but for the most part, that's highly effective. OSHA also mandates what are called engineering controls, and that's doing things to decrease the bloodborne pathogen hazard in the workplace. So devices, engineered devices that decrease your chances of getting a needle stick or any other exposure. You also need to perform environmental control, so clean up all potentially infectious fluids as soon as you can and make sure that you're protected, make sure that soiled linen is appropriately washed, and contaminated trash goes in an appropriate marked biohazard container that's appropriately disposed of on shore. Really, everything you need to know about bloodborne pathogen control you learned in kindergarten. Wash your hands. If it's not yours, don't touch it, especially if it's wet. Cover your mouth when you cough, and clean up after yourself. Really protect yourself. No patient is worth you contracting a bloodborne pathogen. Use the personal protective equipment, use the environmental controls, and clean up after yourself. Please complete any knowledge reviews and contact your professor if you have any questions.